Hello, friends. Welcome to the Sensify Care YouTube channel, your trusted health companion that helps you understand complex lab reports in simple and easy to grasp language. Have you ever looked at your lab report and felt like you were reading a foreign language? HDL, LDL, RBC. What do these numbers and terms actually mean? If such questions come to your mind, you're in exactly the right place. An important note: this video and the Sensify Care platform are created only for informational and awareness purposes. They are not a substitute for a doctor's advice, diagnosis, or treatment. For any health-related concerns, always consult your physician. So come on, friends, a warm welcome to yet another special video from Sensify.
All right, so your doctor hands you that little slip for a lab test and says, oh, and you'll need to fast for this one. Sounds simple, right? But then the questions start. What does fasting actually mean? Can I have my morning coffee? What about water? It can be kind of confusing, but don't you worry. We're going to break it all down step by step. Right? This is the big question. It's about so much more than just skipping breakfast. Getting this right is all about making sure we get the most accurate, true-to-you picture of your health possible. So let's dive in. So before we get into all the rules, the do's and the don'ts, let's talk about the why. Honestly, once you get why you're doing it, remembering the rules becomes so much easier, especially when you're tired and just want that cup of coffee. Okay, first things first. The official term is a fasting sample. All this means is that they're taking a sample, usually blood, after you haven't eaten or had anything to drink besides water for a set amount of time. Usually we're talking about 8 to 12 hours. And what's the whole point of this? Well, the goal is to get a baseline. Think of it like getting a snapshot of your body in its natural resting state, without any interference from a recent meal. It gives your doctor a clean slate to see what's really going on inside. Here's a great way to think about it. Imagine your bloodstream right after you eat. It's super busy, right? It's flooded with sugars, fats, and all the stuff from your food. And that can totally skew the test results. But when you're fasting, things calm down. The levels of those substances go back to your body's normal state. And that is what gives us a truly accurate reading. So you might be wondering, what kind of tests need this? It's really common for things like a cholesterol test or what they call a lipid panel. Same goes for a fasting blood glucose test to check your blood sugar. But it's also needed for bigger tests like a comprehensive metabolic panel or even to check things like your iron or vitamin B12 levels. Okay, now that you know the why, let's get into the how. This is the practical stuff, the golden rules of fasting. We're gonna make this super simple with some clear do's and don'ts. So, how long do you have to do this? The magic number is usually somewhere between 8 and 12 hours. The easiest way to do this, honestly, is to schedule your test for first thing in the morning. That way, you just stop eating after dinner, sleep through most of the fast, and get it done. But, and this is important, always double check with the lab, because some tests might need a little bit longer. Now for the number one question everyone has. Can I drink water? And the answer is a big, loud yes. You absolutely can, and you totally should. Drink plain water. Here's a little pro tip. Staying hydrated actually plumps up your veins, which can make the blood draw way easier for everyone involved. I know, this is the tough one. Your morning coffee, even black coffee, is a no-go. Same for tea, juice, soda, basically anything that isn't plain water. Why? Because things like caffeine can actually stimulate your system and throw off that baseline we're trying to measure. It's just for a little while. You can do it. And what about cheating with a little gum or a mint? Nope, sorry. Even if they're sugar-free, the act of chewing can actually kickstart your digestive system, which is exactly what we're trying to avoid. So it's best to skip those until after the test. Okay, this next one is super, super important. Your medications. For the most part, you should continue to take them just like you normally would, with a small sip of water. But, and I can't stress this enough, you absolutely have to confirm this with your doctor first, especially if you have a condition like diabetes. Never, ever change how you take your medicine without talking to them first. So let's just do a quick at-a-glance summary. In the yes column, drink lots of plain water, take your meds, but only after getting the okay from your doc, and try to schedule that test for the morning. In the no column, no food or other drinks, no alcohol, no gum, and you should also avoid heavy exercise and smoking right before the test. Okay, but what if you mess up? Look, we're all human, it happens. So what do you do if you accidentally break your fast? Don't panic. The answer is actually really simple. You can just picture it, right? You're on autopilot in the morning, you take a big gulp of orange juice, and then it hits you. Oh no, I was supposed to be fasting. Does that mean you have to cancel the whole thing? Here's what you do. The absolute most important thing is to just be honest. When you get to the lab, just tell the person at the desk or the technician what happened. Let them know what you had and what time you had it. They're the experts, and they'll know if it's a big deal or not. And just remember this. It is so much better to be honest and maybe have to reschedule than to go through with the test and get a result that isn't accurate. These tests are important for your health, so we want the information to be as spot on as possible. All right, we've covered the why, the how, and the what if. So let's pull all of this together into one final super simple cheat sheet. These are the big takeaways. Here it is, your 4-point checklist. Number 1, fasting means nothing to eat or drink except plain water. Easy. Number 2, it's usually 8 to 12 hours, but always confirm with your provider. Number 3, if you slip up, just tell the lab staff. Be honest. And number 4, another pro tip. Plan ahead. Bring a snack and a drink with you for right after you're done. You will be so happy you did. And there you go. See? Fasting for a lab test really isn't that scary or confusing once you break it down. By following these simple rules, you're doing your part to make sure your doctor gets the best, most accurate information to help keep you healthy. You are totally ready for this.
Friends, thank you for watching this special Sensify Care video. Now, a small question for you. Would you like to understand the story behind your lab reports in the same simple and clear way? If yes, then like this video, subscribe to our channel, and become a part of the Sensify Care family so that you're instantly notified whenever we post new videos like this. And remember, Sensify Care is now your health companion. If you have any questions or doubts related to lab tests, don't hesitate to write them in the comments section below. We'll do our best to include answers to your questions in our upcoming videos. See you soon in the next video. Until then, stay healthy and stay fit.